Good evening. In this second video, we're going to be extending a model that we created to illustrate the incorporation of some basic health economic structures into agent-based modeling performed in AnyLogic. Our original model, which is described in a separate video and available for download through my website, calculates a variety of quantities that are of frequent interest from a health economics perspective in public health and intervention research. Specifically, this model allows us to capture, for a baseline scenario and then for intervention scenarios, the quality adjusted life years lived by the population over the time frame of the simulation, in this case 150 years. The cumulative life years lived by that population. The quality adjusted life years are weighted by the quality of life a given person experiences. Life years just totaling up the number of years of life across the entire population over time, integrating up the population over time. So taking into account mortality, for example, whereas quality adjusted life years take into account the quality of life. This model also took into account accumulated discounted costs and undiscounted costs, although the undiscounted costs further took into account the new interventions. And I want to first fix that issue. So here we have new discounted costs, which here need to take into account not just these factors, not just the population new costs per year as dictated by the population, something that's taken into account here, but also needs to take into account these interventions. So again, I would do this differently if I were building this model for longer term use. But I think what I'll do is support a second flow in to this accumulated discounted costs, similar to this second flow in above, where we're taking into account intervention costs. Apologies, I just want to make sure that this model is really capturing what we aspire for it to capture. Even though it is stylized, it's important that it capture the basics. Okay, so I will now adjust this flow, go in there, and we're going to create a flow into this discounted cost area that's associated with intervention costs, and not merely the costs associated with this would be new discounted intervention costs, not merely the cost borne by the healthcare system due to people's health state, which is taken into account in this other flow to the left. Okay, so a bit of visual trouble here. So pardon me while I rearrange things a little bit, give ourselves a bit more room. This up a little bit, and we will adjust this guy here so that it's straight as an arrow. Okay. There we go. So now we have, for the discounted cost side, consideration not only of this of the cost borne to the population, to the healthcare system through the health of the population, but we're also going to be able to take into account discount factor times this new intervention costs, where the new intervention costs are costs that are considered undiscounted, and we're going to be able to take into account by discounting them by this factor, this discount factor. We're going to be able to take them into account in a discounted fashion. So we have this discount factor times them. Okay. So let's just see if that builds, and then we can see if it if we have success here. It does indicate that it built successfully. Just to clean up these names here, I'm going to name this new undiscounted intervention cost. That's clearer, and this should be new undiscounted health services cost. And in fact, here, this should be new discounted health services costs, as contrasted with new discounted intervention costs, which will take into account in this other flow instead. So we're going to just arrange things here a bit in this cluttered fashion. Excuse me. I was hoping to be able to rotate this around. There we go. Okay. Okay, so we have now got a situation where our costs here, in a discounted fashion, are simply comparable costs up there. And I think just to sort of complete the symmetry here, I'm going to make this guy depend on this new undiscounted one, this flow, to make it clear. Rather than calling the population statistic, I'll multiply it times the new undiscounted health services costs. There we go. Okay. So each of the flows into this stock here, which is the accumulated discounted cost, is simply a discount factor times the corresponding flows within the undiscounted context. Okay, so I'm doing a build here, and we're getting some challenges here. So let's go see what the problem is. It says new intervention costs. We need to. This is new undiscounted intervention costs. Normally, AnyLogic is pretty good about following those names through, but there we go. Okay, so we've fixed up these components down here, so that the discounted costs are indeed the sort of discounted versions of the undiscounted costs. Let's go clean up this this a little bit in terms of the graphs now that we've shifted things around. Okay, so there we go. Okay. Good. Okay, we're going to get that in full screen mode. We're going to return it. Okay, so let's make sure this builds. It did build. So now let's look at the baseline scenario again. Let's look at its here we have a situation where we have qualities accumulating, life years accumulating. We also have undiscounted costs and, in fact, discounted costs. And you'll notice that the discounted costs, as we might expect, are lower than the corresponding and the undiscounted costs for the corresponding time. Further we go out, the lower and lower this discount factor, the more and more discounting is applied to bring it into present value terms. And we end up with a big discrepancy where the undiscounted costs are much higher than the discounted costs. The discounted costs are approximately $12 million. So now let's do the investigate a scenario with aggressive diabetes prevention. Again, we're running it full tilt. Here we have, in contrast to the baseline, we have costs accruing from the interventions, costs which actually can be larger than corresponding health services costs. And the corresponding costs are that accumulate overall are much larger. These interventions, you may recall, include both screening costs per year as well as some lifestyle intervention costs for those individuals who are found in a pre-diabetic state. So here we have significantly higher costs, upwards of $16 million compared to the $12 million we had before. So in short, we've sort of fixed up these discounted costs so that they are reflective of systematic discounting of the undiscounted costs, including for both the intervention costs and for the health services costs.